noticed a rash, searched online, and now you are not sure if what you are seeing could be herpes. The problem is herpes does not look the same at every moment. It follows a pattern. So what does herpes actually look like? And how does it change from the first symptom to healing? In this video, I will explain you what genital herpes typically look like at each stage of an outbreak. I'm Dr. Slava Fuzailov, a private practice physician at STD Center NY with over 20 years of experience. In this video, I'm mainly focusing on the first herpes outbreak because it usually has the most noticeable symptoms. Recurrent outbreaks are often milder, shorter, and sometimes look different. For each stage, we will look at 4 things: what you may feel in your body, what you may feel on the skin, and what you may actually see on the skin, and roughly when this stage happens during the outbreak. What I'm about to show you is a typical pattern we see in practice, but the exact timing may differ. Now, here is a very important clue. The most important clue is not just how a lesion looks at one moment, but how it changes over several days. Herpes usually follows a sequence. First, irritation, then blister, then sores, then healing. Understanding that sequence make it much easier to recognize it. Let's go through the stages step by step. First, the early stage before visible skin changes. This is very beginning and nothing is visible yet. It usually occurs about 1 to 3 days before visible skin lesions appear. Some people develop flu-like symptoms such as fatigue, headache, fever, body aches, and swollen lymph nodes in the groin. These symptoms happen because the immune system is reacting to the virus. They appear in roughly 30 to 50% of patients and are more common during the first outbreak. In the area where the outbreak will appear, you may notice tingling, itching, burning, or skin sensitivity. These early skin sensations occur in roughly 60 to 80% of people who develop visible outbreaks. At this point, the skin may still look completely normal. There may be no visible change yet. This stage typically lasts about 12 to 48 hours. Because nothing is visible, herpes usually cannot be identified visually at this stage. So at this stage, you may feel something, but you usually cannot see anything yet. Second, the early skin stage. This is where things start to become visible. This stage usually begins about 1 to 3 days after the first tingling or burning sensations. General symptoms like fatigue or low-grade fever may still occur, but they become less common. Roughly 20 to 40% of patients may still notice mild systemic symptoms. At this point, you may feel itching, burning, or irritation in small area of skin. The skin may now appear red, irritated, or slightly inflamed. However, blisters have not appeared yet. This stage often lasts about 1 day before blisters form. At this point, the appearance may still look similar to common skin irritation, so most people cannot reliably identify herpes at this stage. So this is a stage where herpes can still look like simple irritation. Third, the blister stage. This is when herpes starts to look more typical. This stage usually begins about 2 to 4 days after the first symptoms. Now the lesions develop into small fluid-filled blisters. You may feel burning, tenderness, or increased sensitivity in that area. You may start to see small clusters of fluid-filled blisters. These blisters usually appear close together on the same red area of skin. This is an important clue. Herpes usually forms several bumps or blisters grouped together rather than single isolated bump. The blister usually contain clear fluid. This stage usually lasts about 2 to 3 days. Many people first recognize that something unusual is happening during this stage. So this is when herpes becomes easier to recognize visually. Fourth, the alsa stage. Now the blisters break open. This stage usually occurs around day 4 to 7 of the outbreak. By this point, general symptoms are usually minimal or gone. You may feel pain, burning, or tenderness, especially when the skin rubs during movement. When the blister ruptures, the fluid drains and the top layer disappears, leaving small open sores. These sores usually appear a small group on the same red area of skin. Several sores may sit close together rather than appearing as single sore. These sores may look red, shallow, and moist. This stage usually lasts about 3 to 7 days. So this is usually the most uncomfortable stage of the outbreak. Fifth, the healing stage. This is when the skin begins to recover. This stage typically begins around day 7 to 10 of the outbreak. By now, general symptoms are usually gone. Pain and irritation gradually decrease. The sores begin to dry, form crusts, and gradually heal. This stage usually lasts about 7 to 14 days. The entire first herpes outbreak often lasts about 2 to 3 weeks, although the exact timing can vary. So this is a stage where the skin gradually returns to normal. The most important thing to remember is this. Genital herpes does not look the same at every moment. It changes as the outbreak progresses, following a sequence. At different stages, the skin may look completely normal, red and irritated, blistered, ulcerated, and healing. So instead of focusing on how it looks at one moment, focus on how it changes over several days. This is often what helps you recognize whether a skin lesion could be herpes. If this explanation was helpful, you can subscribe for more clear medical explanation about sexual health and STD condition, and like us.